Okay, we will start the next session. Okay, so before starting, I would like to ask if you in Vietnam, do you frequently do a gallium dotatok scan, gallium dotatok PET-CT?
Actually, until now, we still do not have a dotatok PET scan in Vietnam.
Okay, so the last session, what I would like to discuss is about the quality control issues in nuclear medicine. So we would like to share some cases that we encountered recently, why this quality control is important, and we would like to hear some comments from the aspect of radiochemists. So I will share some cases. So for the first case, so as you have known that we have, because there was no therapeutic options for neuroendocrine tumors in Korea, we have sent our patients abroad to get this PRRT therapy. So 5 patients actually went to Malaysia to get this PRRT therapy. And as you can see, this patient has a, you can see a gallium dotatok uptake in the liver. So which means that there is a pancreatic tumor with many disseminated liver metastasis. So for the treatment of this lesion, the patient undergone the PRRT, and it was done at 13th of November. And however, the post-therapy scan of this lutetium dotatate scan, as you can see, is quite different, actually significantly different. Significantly different distribution. So the right image seems like rather like a bone scan rather than a dotatate scan. And at the same day, there was another patient who had got this PRRT therapy. This patient had also a pancreatic neuroendocrine tumor with liver metastasis. However, at the first cycle of therapy, which was done previously to November 13th, this patient in the lutetium dotatate scan shows similar distribution compared to the dotatok PET, which shows a large and many liver metastases, as you can see here. However, at the day of November 13th, as you can see, after the therapy, when this patient got the lutetium dotatate scan, it rather seemed like a bone scan rather than a dotatate scan. So immediately we see this, after they came back to Korea, when we saw this image of the post-therapy scan, we immediately did the bone marrow function test. We evaluated them with CBC results. Because if there is that kind of diffuse bony uptake, bone marrow uptake, this patient might have a severe radiation effect along the bone marrow. And as expected, the patient showed significant reduction of bone marrow function, almost right after. So the patient got the injection at November 13th. However, it drastically dropped within 2 weeks. Fortunately, this patient, after some induction of GCSF and platelet transfusion, the blood count actually recovered. However, second patient with this pancytopenia also accompanied with neutropenic fever. So although we gave them antibiotics and best supportive care, we actually lost the patient. So we wanted to know what was wrong, what happened to these patients, why the reason this kind of abnormal post-scan image was seen after the treatment. So we requested a TLC result of that drug which was injected to the patient that day. So this was the TLC result which was provided from the hospital which had done the therapy. And as you can see, there is a single peak of TLC and with more higher ROI more than 95%, which means it is quite pure, a significantly pure radioactive agent. So as they check the single peak, they have injected this drug into the patient. Then what was wrong? So, but interestingly, at the same day, there was another patient who had PSMA therapy with lutetium-labeled PSMA therapy. And this patient actually, as you can see, compared to the first cycle, you can see that the distribution is not like the dotatate, and the distribution is similar to the previous scan, which means that lutetium PSMA have injected well and had no problem. So wonder what do you think is the reason? And I'll move on to the second case. So we do in Korea, and in our institute, we do more than, for now, we had done more than 400 or 500 cases of gallium dotatate PET-CT. However, recently we have encountered very abnormal image of gallium dotatate, which was acquired in May 22nd of May. And as you can see, it seems rather like a blood pool imaging agent rather than a gallium dotatate. So we checked what was wrong to see, we checked the TLC. However, there seemed to be a single peak. And interestingly, we have done again a repeat test for this patient 5 days later at May 27th. And again, we checked the TLC, and as you expected, the TLC result is similar to the previous one. However, it seemed the image is absolutely different image was acquired. So as you can see again, there are some lesions seen, like bone lesions are seen, as you can see in the MIP images, but mainly the image are reflecting the blood pool rather than other like metastatic lesions. And again, when you see the TLC result, actually there seems to be no difference between two particles. So what do you think was wrong from the two previous cases? So I think that's what we should figure out, and that I think will be commented by Professor Yoon-sang Lee.
Okay. Do you think what was wrong? So I have answer to that question. that's why we have to do the quality control of the radiopharmaceutical, because of that kinds of things happen in everywhere in the world. So again, you can see the picture of the unwanted image, and these two images are the properly prepared radiopharmaceutical mutation data TEIN images. So as Dr. So mentioned that this one peak means mutation data TEIN. So after getting these images from somewhere in the world, they asked our department what was wrong from these images. Because of earlier rotation data therapy, that can show the hotspots of the neuroendocrine tumor site. But in this case, there were several bone marrow uptake and soft tissue uptake. So right after getting that image, I asked them to deliver the TLC data from that synthesis. So I got this TLC from them. So I think, okay, this is only one peak, and I think that the purity will be not so problem. So, but they didn't give us that developing solvent condition. So I asked them, okay, then can you send us that development solvent condition, and also earlier you did the same TLC, then please send us, you can send us that TLC to compare that last one and earlier one. So finally, we got TLC from them of the earlier one, and you can see the entirely different RF value of the earlier one and last one and early one. So you can see that this 25th TLC data means RF value is almost 0. So, but in the 13th November TLC data is RF value is around 0.8. So these two TLC data is entirely different. So finally, they said that, oh, TLC is different from the earlier one. So they said that, okay, we have to find that what's the problem of the synthesis process. So finally, they know that they found that the heating process has problems. So because of heating heating machine was broken. So what's the problem of this accident? Because of they, even though they did a TLC experiment, but they cannot understand what's the meaning of the RF value of the rotation data TEIN. So I think a TLC, doing TLC is very important, but you have to understand what's the real RF value of that wanted our radiopharmaceutical. And another example of the FDG QC event, I got mail from outside of our hospital. They said after injection of FDG, patients show that high liver and bone uptake in the PET images. So please check the TLC first. Then I said, and then they check the TLC. Oh, okay, there's no problem of TLC from the supplier. And okay, then I think you have to do by yourself in your hospital. So they did a TLC, and then they got some extra peak beside to the FDG peak. So I think these are the maybe the acetylated FDG. So, but even though that acetylated FDG showing, but there is no F18 peak here. So how can we explain that the bone uptake? So please synthesis again of the FDG, and the second production, finally we got found that the F18 and acetylated FDG and final product of FDG. So finally we can figure out that what's the problem of that PET images of the patient. So I think normally nuclear medicine physician, they realize that the problem from the images, but chemist or radiochemist, they realize that from the problem of the radiopharmaceutical from the TLC. So that's why TLC is very important, and also by yourself you have to take a TLC in your department. That's very important. Another example of our hospital, you can see here already. Dr. Saul mentioned that the first image shows, I think, just like a blood flow image. Second one is a proper image for neuroendocrine tumor. So right after getting these images, we think that, okay, well, I think that is look like a human serum albumin image. But we use the gallium and we use the DOTATO kit, but we got the HS human serum albumin image from that patient. So right after that, we have to check the TLC first. Okay, those TLCs is almost the same. Because of that, RF value is 0. But pH is different. We found that the pH were different. Earlier one that the blood plasma imaging showed the pH 3.4, and then proper image means pH 4.3. So we make these two different pH solution of the gallium DOTATO, and then TLC also same, and protein binding also same. But and also we got image from mice, and that mice image is almost same. I think earlier image can show that because of that gallium DOTATO has a high protein binding ability. So we think that this image can be obtained right after the injection. That can be shown like this. But in case of mouse image, after 10 minutes, you can see the high kidney uptake and blood uptake. So that means that gallium DOTATO without any targeting site, just they can pass through the kidney. So there is no difference. So still we cannot figure out that what's the problem of the gallium DOTATO images of the patient. I think I assume that if we have kinds of gallium HS kit in the gallium DOTATO kit, then I think maybe that kinds of things happen. So in this case, our quality control means that the whole data from the QC and include process QC is very important. So in this case, our DOTATO kit is located in the refrigerator. In the surface of that DOTATO kit has no label. So because of we purchased DOTATO from ABX company, and then because of that DOTATO, they sell only 1 milligram vial. So we divided into several vials, more than 30 vials for 30 microgram microgram per vial. So we lyophilized it, and then I think somebody has a responsibility to attach the label, but they didn't do that. So I think that QC process is including the whole process of the radio labeling, and then how can we keep all the vials or the supplements in properly. So that is a whole QC process. So we can understand why, and then after that we found that that vial has problems. So we withdraw all the vials and we lyophilize again to get that DOTATO vial, and also definitely we attach the label on it. So quality control to ensure that purity and safety, and also efficacy and potency. So quality control is very important, including radiopharmaceutical itself and also whole process. There are so many items to get quality control. You can see the physical chemical property and pharmaceutical property. Because of the radiopharmaceutical contains the radioisotope. Radioisotope contains the half-life. So normally in the our nuclear medicine field use the relatively short half-life radionuclide. So whole process for a physical chemical property can be done before injection of the radiopharmaceutical. This sterility and endotoxin test should be done after the injection of the radiopharmaceutical. That all the QC item is listed in the Korean Pharmacopoeia and also USP 32 NF227. We have this kinds of dedicated quality control room contains the hot cell, dedicated hot cell. In this hot cell we can do the TLC and also endotoxin test here. And outside of that dedicated room for radioisotope, dealing with the radioisotope, and in this area we have QC for chromatography, for GC and HPLC, and another machine was there for another QC protocol. You have to right after the making radiopharmaceutical, you have to see by yourself, by your eyes, own eyes, through the vial, and you have to check the color and clarity for vial. So you have to look at the under the white light source about 1,000 lux. And also you have to check the pH with the pH history or pH meter. And in case of pH meter use, you can get the printout result for pH QC result. and then you can attach it with printed paper to the QC sheet. And here you can see the whole TLC procedure. So you can put the TLC strip, you can put the radiopharmaceutical on the TLC, bottom of the TLC strip, and then developing of the proper developing solvent. And then you can get these kinds of TLC strip after a few minutes. And here you can see the spot on the bottom of the TLC strip. And then you can use this kind of TLC chamber for developing of the TLC. And also that mobile phase or developing solvent, you can find the proper condition for developing solvent. So you can find in the textbook, especially for technician radiopharmaceutical, you can find in the table of the textbook. And after the developing, you can get these kinds of TLC strip. If you have a TLC scanner in your department, you can just cut this half of the strip, and then if you have a TLC scanner, then you put this strip on a TLC scanner, then you can get the TLC chromatogram. But if you don't have, then you can cut this area, and then you can put these two or divided strip into the gamma counter or dose calibrator, and then you can check the radioactivity from here and here, and then you can calculate the RF value of this radiopharmaceutical. If you don't have that, but I think sometimes that RF value of radiopharmaceutical is around 0.5, then you can cut this area. So you can divide it 3 portions or 4 portions, then you can calculate the RF value of that radiopharmaceutical. And you can see how can we do the TLC scanner, scanning of the TLC scanner. And then finally, we got these kinds of spectrum of TLC. Then we can calculate the purity of that radiopharmaceutical. And sometimes we have to do the chemical purity check. Because of the F18 FDG production, we need to use the Kryptofix 222. So we have to check the chemical impurity of the Kryptofix 222. So normally, sometimes we can do the TLC or spot test, and we use the spot test for that FDG production. We purchase from this kinds of kit, and then we put the FDG solution onto that kit, and then a few minutes later, we can get these kinds of images, and then that limit is around 40 ppm, 50 ppm. So color, the darkness of the color we can compare, and then we can put the 20 or 10 or 5 ppm on the result sheet. And radionuclidic test can be done with can be calculated from the half-life. So you simply put in the dose calibrator, and then we can check the timely with the radioactivity, and then you put the Excel sheet, and then finally we can calculate the half-life. Then that, in case of F18, the physical half-life is 109.8. So you can compare the exact calculated that this half-life can be inside of the 10% deviation. So we can say that radionuclide purity is passed. And sometimes we can use gamma ray spectrometry using gamma counter or multi-channel analyzer to check the radionuclide purity. So you can see the only two peaks from the F18, 511 and 1022 kiloelectron volt. And another thing, we have to do the endotoxin test. Earlier, we used a live test kit for endotoxin. So gel-clot technique was done by the gel-clot kit. So in case of endotoxin, that should be less than 175 EU for ml. So earlier we used this method, but it will take 1 minute, 1 hour. So in case of us, this endotoxin test is done before injection in our department. Before injection to patient. So we use this chromogenic technique. So we can use this kind of portable kit system. So we put that FDG on this kit and then put inside of the machine, and then finally we got the result from this machine after 10 minutes. So we did endotoxin test. If you available these kinds of portable machine, then I think you can use these kinds of things. But if you don't have you still you can use that live test kit also. And sterility test can be done by ourselves in our department. But if you don't have the kinds of facility, then you can wait for decaying of the F18 and then send to the other department or other institute. So we have this kinds of dedicated room for sterility test and also facility. And also we have to purchase that media for that microorganism incubation. And also we have to check the residual solvent. In case of us, we have two different organic solvent, ethanol and acetonitrile. They have a limit for residual solvent, and you can check with the gas chromatography method. And sometimes you have to use the HPLC for check the purity of some kinds of radiopharmaceutical. In case of us, we have to use a FDOPA synthesis, because of FDOPA can possess that two different isomers. Here you can see here D and L form. So that's why we have to separate the F18 FDOPA with the HPLC, and then we finally got the analytical HPLC of the F18 FDOPA. So why should we do QC? Because of that, we are sure to the patient safety, and also maintain the quality of images, and also set up the standard of the radiopharmaceutical center for a technician and also radio pharmacist and also radiochemist. And after some kinds of problem from the images, then we can find what kinds of process has a problem of this synthesis. So we have to figure out that which processor has problems. So we can see the proper result from the QC. Then we can find who has a responsibility of the that radiopharmaceutical problem. So this is the end of my presentation, and please, can you translate this?
Yes, certainly. Vâng, em xin tóm lại cái nội dung bài cuối cùng. Bài cuối cùng thì là về kiểm soát đảm bảo chất lượng điều trị, thì bắt đầu với 3 ca lâm sàng. Trong đó có 2 ca lâm sàng là u thần kinh nội tiết, đại tụy, di căn gan đa ổ, điều trị liệu pháp Glutathione 177 gắn Dotatat. Thì có một điều bất thường ở đây là 2 bệnh nhân đầu tiên này kết quả ghi hình trước điều trị và sau điều trị khác nhau quá nhiều. Và người ta đặt vấn đề điều gì đã xảy ra. 2 bệnh nhân này thực ra là người Hàn Quốc điều trị tại Malaysia, và sau khi về đến Hàn Quốc thì xuất hiện tình trạng hạ bạch cầu. Một trong 2 bệnh nhân đã tử vong. Và cuối cùng thì người ta dùng phương pháp sắc ký lỏng. Trong trường hợp này sắc ký lớp mỏng thì người ta phát hiện ra rằng là cái thuốc mà tiêm cho bệnh nhân này có vấn đề, và đã giả lại toàn bộ quy trình sản xuất thì phát hiện ra là cái máy ủ nó bị hỏng, nghĩa là cái thuốc tiêm vào trong cơ thể bệnh nhân nó có vấn đề. Và từ đó đặt ra vấn đề là chúng ta phải đảm bảo chất lượng trong kiểm chuẩn cái sản phẩm rồi chất phóng xạ mình tạo ra. Thì nó có nhiều bước cả về điểm vật lý như là quan sát màu sắc, độ pH, rồi dùng sắc ký đánh giá tính tinh khiết phóng xạ, tính tinh khiết hóa học, rồi cái hàm lượng dung môi tồn dư, rồi cả là điểm dược lý, điểm vô khuẩn, nội độc tố. Thì kết luận cuối cùng rằng tất cả những cái bước kiểm chuẩn đó để đảm bảo cho chúng ta đưa được ra cái điều trị an toàn, hiệu quả, và nó cũng là trách nhiệm của những người làm liên quan đến công tác này, và cũng để xây dựng tiêu chuẩn cho cái đơn vị điều trị của mình. Em xin thành cảm ơn.
Okay, thank you very much. And also, I have a question from the chat box. So somebody asked me that, do you have a GMP at your site? Yes, we have. And also, which kind of GMP, WHO, IAFO, EU, or US to apply? Because of, in case of Korea, we set up the GMP protocol for especially for radiopharmaceutical, is a year of 2015. So before 2015, we don't have any GMP regulation for production of radiopharmaceutical. In that day, we prepare the GMP protocol, GMP guideline. We refer the EU guideline. So that is a resembles with the EU guideline, because of the EU guideline is more strict than the US guideline. But I think almost the same procedure of the whole GMP, but we think that that EU guideline has a somewhat strict than US.
Câu hỏi là ở chỗ cái chỗ của bác ấy là có cái tiêu chuẩn GMP không, thì câu trả lời là có.
Okay. Another question is there. The spot test kit. What brand of the kit, and where can you buy it? I think I never did by myself, so I have to ask to our colleague in the cyclotron center, and then I will give you answer. So please mail me at the chat box. My mail address in the chat box. Okay. Then I'll give the information of that. Okay. Thank you very much.
Nói về cái spot kit là cái test để kiểm định tại chỗ ở cái chất lượng của sản phẩm dưới chất phóng xạ tạo thành, thì thực ra phó giáo sư thì cũng không trực tiếp làm nên sẽ phải hỏi lại nhân viên rồi sẽ báo lại sau và có để lại email, và ai có quan tâm thì sẽ để lại email và giáo sư sẽ trả lời trực tiếp ạ.
And also, you got mail address from that chat box, and then please give me any kinds of things that you can ask, then mail me anytime. Okay, thank you very much. And I think this is the last session, and I think closing remark will be done Dr. Fung, from the Dr. Fung.
I would like to thank everyone who have participated to our workshop, and I especially thank Dr. who have translated all our lectures. We really are thankful. And again, we would like to ask some favors for all the participants to participate for the survey so that we can have some comments and better contents in the future meeting. And I would like to meet everyone again soon. Thank you very much for everything. Thank you.
Thank you. Bye-bye.
Thank you.
Thank you so much. And